Many people today don't realize that smallpox and chickenpox are two completely different diseases. This confusion has led to viral posts, misleading memes, and even entire anti-vaccine arguments built on a mistake. While some people believe they are fighting against a vaccine for a harmless childhood illness like chickenpox, they are actually spreading skepticism about the smallpox vaccine, one of the most successful vaccines in human history. Smallpox was a deadly and highly contagious disease caused by the variola virus. For thousands of years, it killed millions of people, caused severe scarring, blindness, and had a fatality rate of around 30%. In contrast, chickenpox is caused by the varicella zoster virus. It is uncomfortable, but usually mild, especially in children. The two illnesses are unrelated, even though their names sound similar. The confusion often begins with historical photographs. Old images of smallpox patients show people covered in large, deep pustules. These pictures are nothing like the small, superficial spots seen in chickenpox. But people unfamiliar with the difference sometimes assume those images show an extreme version of chickenpox. As these images circulate online without proper context, users begin spreading the false claim that chickenpox was once deadly, and that older generations didn't need vaccines for it. This misunderstanding feeds directly into anti-vaccine narratives. Some people believe that because smallpox was eradicated, vaccines today must be unnecessary. Others claim that the smallpox vaccine was harmful, not realizing that without it, smallpox would still kill millions. A portion of the online anti-vaccine community even insists that governments are creating fear about chickenpox, when the vaccine they criticize actually targeted smallpox, a completely different and far more dangerous virus. The problem grows when individuals repeat statements like our grandparents had smallpox and survived without vaccines. In reality, they almost always mean chickenpox, which nearly everyone used to get in childhood. Smallpox, on the other hand, was feared for centuries and caused devastating outbreaks until the global vaccination program eliminated it in 1980. Confusing the two distorts history and reinforces the false belief that vaccines were never needed or effective. This mix-up has become a powerful tool for misinformation. When people believe they are opposing a vaccine for a mild childhood illness, they feel justified and confident. But they are actually sharing arguments that only make sense if someone has completely misunderstood the diseases involved. This creates a chain reaction, spreading skepticism among people who are unaware of the scientific and historical facts. Educating the public about the difference between smallpox and chickenpox is essential. Clear explanations, accurate visuals, and historical context help stop the confusion before it grows into another wave of misinformation. Understanding that smallpox was eradicated because of vaccination and not because it was harmless helps people see why accurate information matters and why misinformation can easily take root when words sound similar, even if the diseases are not.